As EMS providers, airway management is at the cornerstone of our skills toolbox. But what happens when we can't ventilate or intubate our patients? At that time, a surgical cricothyrotomy may be needed. And are you going to be prepared to do it? What we really need is a quick fix. I'm Chris Cebollero, and this is the Innovation Zone. As EMS providers, we really have to be diligent and even sometimes aggressive when it comes to airway management. But sometimes airway management isn't going to be used with our basic skills or intubation, whether it's trauma to the mandible, emesis, or even fluid that's building up inside the airway. Sometimes a surgical intervention is going to be needed. Well, today's innovative product is the Quick Fix Cric Kit, and this is really a great and innovative product that I'm happy to share with you. You know, one of the innovations that comes with the Quick Fix Cric Kit is really how it's packaged. And I know it's kind of amazing to say that, but I was really taken by the innovation. You know, when it comes to dealing with surgical crics, a lot of times we don't know the material that's in there. You know, we were trained a year ago, we were signed off, we did a competency, but now it's 10 months later, we've got to go ahead and do the skill. I don't remember what's in the package. But since this is a clear package, it gives us the opportunity to see what materials are in there. You know, surgical crics are really one of those critical skills that we need to do, and we need to do well the first time. But what's really interesting about it is this is a low volume skill. They say that less than 1% of our airway management is surgical interventions. But what's really great about this product and very innovative is the fact that they have step-by-step instructions that really take us through the skill. So think about it now. Once a month when we're looking through our truck, we can go ahead and pull this out. We can refresh on what the steps are because we never know when that call is going to go out where we need to utilize this kit. Let's go ahead and look at some of the components of the Quick Fix Cric Kit. If we go ahead and open up this package, what you're going to see is you have a disposable scalpel. This is going to give you the opportunity not only to cut through the skin, but when you need to make the opening in the cricothyroid membrane as well. Another tool that we have inside this kit is forceps. And what's really great is it gives us the opportunity to open the cricothyroid membrane, and also the curving gives us the opportunity to use it like a tracheal hook to lift the trachea if we need to help pass that tube. We have a 6.0 tracheostomy cuff tube. This really gives us the opportunity to kind of get it in the varying size of patients. You know, we can go from a small female to a large adult male, and we really need to have that variation of how we can get that tube in. So that number 6 really kind of helps us out. We also have a 10 cc syringe. What this does, it allows us to fill the pilot balloon, which will inflate the cuff inside the trachea. Let's go ahead and look at the procedure of how to use the Quick Fix Cric Kit. Now, before you start the procedure, you need to make sure you clean the site in accordance with your local protocols. Once you hold the skin tight, the next thing you do is to make a 1-inch vertical cut. Now, as you make this cut, one of the things that you may realize is you'll have to cut a couple times to get to the cricothyroid membrane. Once you see the cricothyroid membrane, you want to make a horizontal cut. Now is where we introduce our forceps and we go ahead and open up that cricothyroid membrane. Remember, since it's curved, it gives you the opportunity to lift the trachea if you need to. At this point, this is where we can introduce the number 6 tracheostomy tube. After we go ahead and put the tube in place, we want to put our bag and we want to go ahead and deliver a couple of breaths. Now we want to go ahead and listen to breath sounds similar to that than we would at a regular intubation. As EMS providers, our airway skills got to be as tight as they can be. And when it comes to a surgical cricothyrotomy, we really have to know what we're doing. We really need that quick fix, and that's why I was excited to bring you this product today, the Quick Fix Surgical Cric. One of the great things about it is you have these step-by-step instructions that are on the front. You know, we check our trucks out every day, but who's to say once a month we can't pull these out, look at the pictures, and give us that confidence we need that if we need to use this skill, we're able to do so. And another great innovation is the clear plastic. You can see everything that's in here. When you open it up, there's no surprises. Oh, did I mention it was quick? And by the way, it comes in a junior version as well. I'm Chris Cebollero, and thank you for joining us on the Innovation Zone.